But today we are reporting what I believe is the second highest number of cases we have had since our first case on March 6th, with 797 new cases of COVID-19. That brings our total number of cases to 25,931. What it means is that we are continuing to see an increase and a growth that we absolutely have to stop. And we'll be watching these very carefully through the weekend, and if we do not see the numbers come down, we're going to have both a series of recommendations and steps that we'll need to take sometime early next week. Remember that we still have a known mortality rate of about 3%. And if you apply that to 797 cases, it means we expect to lose a lot of Kentuckians. And when you add up yesterday and the day before and the day before that and the day before that, it's going to be heartbreaking. So let's make sure that we are more committed than ever. Let's make sure that we are not violating these basic rules that we know can help us. Let's make sure we realize that each and every one of our actions can impact someone else. And let's just realize that this thing is escalating in Kentucky, that we are seeing more cases than we ever imagined before. And now is the time for everybody to recognize the severity of the situation that we're in. Total number of tests to date, 574,233. That's 8,743 more tests than yesterday. Our number of people currently hospitalized is up from yesterday. It's at 618 today. ICU is down a little bit, 130. But our positivity rate today, based on our rolling average, is 5.28%. That is now over the 5% mark that the White House and others suggest is in a danger zone, and where they begin to recommend that we start taking steps. Now, yesterday we were under that. Today we're over it. We're going to want to see what happens in the next couple days. Again, we're at least a couple weeks now from when our requirement to wear facial covering started, so we need to start seeing some impact from it. I hope different things that went on after we put that into place didn't suggest to people that they didn't have to wear one of those. So we all know now that it's not just a requirement, it should be our duty. Again, how we manage this crisis, whether we can bring down cases, is going to determine how many lives we lose, is going to determine what economic impact we have going forward, because our reopening and our economy are now tied to how well that we deal with this virus. And it's going to be directly related to when we can get our kids back in school for in-person classes. New cases by county: Jefferson 206, Fayette 76, Warren 41, Kenton 27, Boone 26, Bell 23, Harlan 17, Bullitt 16, Barron 15, Hardin 15, McCracken 15, Scott 15, Laurel 14, Campbell, Henderson, and Shelby 12, Jessamine 11, Knox 10, and a number of others. We continue to see young children under 5 more and more test positive. Today we have 19 kids under 5. The youngest being 1 month old, a 1 month old little girl and baby girl in Laurel County. So let's remember that this is spreading to everyone, that everybody can get infected, and that everyone can spread that infection. Today we're also reporting 7 additional deaths. That's 7 more Kentuckians that we have lost to this virus. And again, we see people in their 50s and in their 60s in this list at a level that seems to be increasing daily. A 59-year-old woman from Hardin, a 54-year-old woman from Warren, a 66-year-old man from Oldham, a 74-year-old woman from Warren, an 85-year-old woman from Jefferson, an 82-year-old man from Jefferson, and an 81-year-old man from Boone County. Let's remember these families need our help, and because of the surge in cases, we're probably going to see more families out there that in the near future need our help. So let's not get tired. Let's light our houses up green. Let's ring those bells every single morning at 10 a.m. People need us now more than ever, not just to wear the facial covering, not just to engage in social distancing, not just to cut their social occasions at their home to 10, not just to cancel your vacation if you're going to any state that has above a 15% positivity rate, but also they need your compassion and they need your help when they have suffered the worst. Long-term care facilities. We have 4 additional residents and 18 additional staff that have tested positive, 6 additional deaths attributed to residents. 3 new facilities now have additional cases. So that's the tough news, and it's tougher news than we faced in a while. And again, it ought to be sobering, but it ought to make us committed to doing what it takes moving forward. We are still dealing with the world as it was about 2 weeks ago. And I don't think that we as a state are acting the same way we did 2 weeks ago. I think we are doing a lot better in what it takes to defeat this virus.